Hey, it's Dr. Dan Cooper here, and I've got another question from the crowd. This has to do with periodontal disease. So I was having a conversation this past weekend where it was divulged this person has periodontal disease, and I asked, well, what were the recommendations given to you about this? And the recommendations were to receive a dental cleaning, likely a deep cleaning, once every 3 months. So there's a shortened interval for the dental cleaning. And that was it. So I thought, there's a number of other things that should be done to idealize your outcomes here, and why not have somebody like me tell you what to do? So here's a few things that you can do regarding periodontal disease. So first, what is periodontal disease? Periodontal disease is an infection above the gum line and the roots of the teeth in the jaw and the gums, so that component of the mouth. And how would you know if you've got periodontal disease? Lots of things. So you could have chronically bad breath. You could have tooth or jaw pain, especially when chewing. You could have red or swollen gums, maybe bleeding gums if you were to brush or floss and the gums bleed. Loose teeth, potentially losing teeth if it's more progressed. And receding gum line is another one. So risk factors that go along with periodontal disease, if you kind of wondering, okay, maybe I do have this. We should check this out. Some things that could be in your history that would increase your chances of having periodontal disease. The number one thing is smoking. Diabetes is another one. So any sort of dysglycemia issues, if it's diabetes, prediabetes, insulin resistance, these terms that are all really talking about a different spot on the gradient of the same thing. We have hormonal changes can cause this as well, and there's certain medications that decrease saliva flow, whether it's production or actually release. In either case, when the mouth is drier, you have a higher propensity for bacteria to grow and flourish. Another would be poor oral hygiene. So risk factor would be poor oral hygiene. If you let plaque hang out in the teeth and grow and dig underneath the gums and then infect the jaw or maxilla, this is you promoting periodontal disease. So what do you do? Now in this case, I had talked to this person and the advice was given to increase or decrease the interval between cleanings. Good advice. But what do you do in the meantime? So personal habits. There's some dietary things, for example, decrease carbohydrate load. It's funny, we think sugars, and definitely decrease sugar load, so sugary drinks, candy, like that sort of thing. But really, any flour product, any of these complex carbohydrates, when in your mouth, salivary amylase is an enzyme that's in your mouth, converts those complex carbohydrates to simple sugars. So decreasing overall carbohydrate load will improve your outcomes with this. We have an anti-inflammatory diet too. So dump the carbs and increase anti-inflammatory foods. There's a lot to this, so I'm going to just set it here as incorporate an anti-inflammatory diet. I have other videos describing what that actually means. And then we have the oral hygiene component of this. Brush, floss, Waterpik. Do all three. So brushing removes majority of the plaque. Flossing gets between the teeth. Waterpik washes it all away. And you can include, over just water in the Waterpik, you can include some mouthwash. So antimicrobial mouthwashes, typically people think Listerine. Fine, use that. I've used Periodontal in the past with a lot of success. You can use the Periodontal Cleanse, and the other product is Complete Oral Care, it's called, which is the mouthwash. These are all good choices. So idealize the diet and idealize your personal oral hygiene regimen. And I should mention twice a day. So do the same regimen. So this brush, floss, Waterpik with whatever you want to put in it, whichever mouthwash you like. Do it twice a day. And that will take you leaps and bounds in your process of resolving the periodontal disease condition and lessening symptoms along the way as it's healing. I hope that was helpful to you and ushers you into a new realm of lovely oral hygiene. Have a great day.